Hi, YouTubers. Something important, something kind of damn important. So, today's microphones right now. Today's microphones a big ass cigar. So, also not doctor for the last damn time. Anyway, talking about this right now, essentially, how often is too often to use the bathroom? You have the bathroom, nice big ass bathroom, like the big ass cigar. You have the toilet, nice big ass toilet, like the big ass cigar. Nice big ass crapper for life. And essentially, how often is too often to use the bathroom? Now, obviously, I'm not a doctor, I'm not a freaking doctor. Anyway, basically, I would say anything more than a couple times a day. So the average person, now let's talk about number one. Number one, which is piss. If you are not drinking a ton of fluid, like you're not having like your typical, 8 ounces of water a day or 8 glasses of water a day, rather, then you shouldn't be peeing like more than 5 or 6 times a day. Because that's just not normal. If you are pissing every hour on the hour and you're not drinking a ton of fluid, or you're not pregnant, or for example, you're not on medication, like I'm on a diuretic or a water pill myself for blood pressure, that's the reason why I piss more. It's if you're not on a medication or you're not pregnant, you don't have a medical condition that makes you piss more like diabetes, then you shouldn't be pissing any more than I would say at the most five or 6 times a day. That's something to keep in mind. Now in terms of number two, crap or shit, number two, poop. I would say at the most for the average person about 2 or 3 times a day. The average person who doesn't have a colostomy, who doesn't have any kind of underlying medical condition that they know of, like ulcerative colitis or Crohn's disease or irritable bowel syndrome, IBS or IBD, doesn't have celiac disease, doesn't have a food allergy, or they're treating their food allergy, they're treating their celiac disease, which they should be doing that in the first place. I would say at the most 2 to 3 times a day. You should be taking a crap, taking a shit, 2 or 3 times a day, taking a dump, 2 or 3 times a day. If you're taking a dump like 5, 6, 7 times a day, then something is wrong. I mean, something is damn wrong with you, because it's I'm not trying to be rude to you. It's rude ass like the big ass cigar, but no person should be taking a dump 6 times a day. Now, obviously, people can get sick, for example. You could get a virus or the flu, for example, and you could, for example, have a little bit of diarrhea, not to be gross, and yeah, that's perfectly normal to have a little bit of diarrhea when you have the flu, and that's perfectly fine. However, if you're having consistent diarrhea or consistent constipation, and you're having a significant change in your bowel habits, especially if you're older, it's really time to see a doctor, because that can be an early sign of colon cancer. You really want to be fucking careful about that crap. No pun intended. Anyway, that's about it. Pissing, you should be pissing 5, 6, 7 times a day at the most, unless you have underlying factors, and you should be taking a dump probably, I'd say, 2 or 3 times a day at the most, unless you're eating a ton of food. I mean, obviously you're eating a ton of crap, big burritos, big hamburgers, big ice cream sundaes. Obviously that can factor in also, but no person should be taking a dump more than 4 or 5 times a day, the absolute most. Anyway, obviously not a doctor. Anyway, pretty fucking cool. Bye.